The McCormick Research Institute in St. Cloud, Florida is home to the Horses and Heroes program, an equine-assisted therapy for veterans struggling with post-traumatic stress disorder. Joining us right now is Dr. Minette Monroe with the University of Central Florida College of Medicine. Thank you for having us, Dr. Monroe.
We're really glad you're here, and we'd love to tell you about our program.
Well, we should also introduce Jake, by the way.
Yes.
This is one of our therapy horses, Jake, and he is one of our very best.
Dr. Monroe was looking for a therapeutic riding program to partner with the College of Medicine when she heard that McCormick Institute had a program called Heavenly Hooves.
Originally, Heavenly Hooves was the first program, and it worked with civilians who had disabilities, both adults and children. I met all of the partners who were there, and we talked about starting a veterans program, and that was 6 years ago, and now we're here.
How did you come up with the thought that equine therapy would help veterans with post-traumatic stress disorder?
Well, horses are something we're not really familiar with, and one of the things that people who are returning from the military, returning from battle zones need to do is to step outside their comfort zone. Everyone knows dogs, they're familiar, and they're wonderful and great canine therapy, but horses are a little different. Not everybody has a horse, and it's so outside of what they're used to in any other part of their life that once they conquer this, they feel like they can do anything.
The biggest obstacle at first for the civilian staff is getting the veterans to trust them.
Our focus is really their well-being and their recovery and their reintegration into society and being connected with their families again. So when they kind of come here and realize that's what's going on, then that makes it even more comfortable for them.
And how quickly do you often see results where you see the veterans kind of coming out of their shells and...
The next session.
Really?
Yeah, seriously. They come to the first session and they're kind of dragging their feet and they're not sure they want to be here, and they're waiting at the door the next time around.
What sort of activities do you do with the veterans? I know there's some groundwork, I guess, as well as riding work.
We do riding work, and we do work without riding as well. And the work without riding actually consists of asking the horse to move its body without touching it. And you're asking the horse maybe to go through an obstacle course or to move away from you and trot around a circle, something like that. And it's showing you that you don't have to use force.
In the future, Dr. Monroe hopes to be able to transport soldiers from the VA hospital so they can also enjoy the benefits of horse therapy.
We also want to be able to work with those people out in the other therapeutic riding centers to help them learn our protocol. One of the big issues that's been going on with therapeutic riding for veterans, a lot of people are doing a lot of good, but it's kind of hit or miss as to what protocol they're following. So we're trying to work up a way that we can prove empirically with data it actually really improves and works.
How are they hearing about the program itself?
Mainly it's Katie Wall, our therapeutic riding instructor, who goes to the Wounded Warriors meetings and various other outreach meetings that occur for the veterans around the county and the Central Florida area, and also word of mouth.
Katie Wall is the Horses and Heroes program manager.
So tell us a little bit about the program and what you do here.
We have a very unique team, so we're affiliated with UCF College of Medicine, and we are a nonprofit, and we are McCormick Research Institute, and we also have a mental health professional from Turning Point Counseling Services.
The program is 10 weeks long, once a week for 3 hours. Each session starts with a warm-up exercise.
And then we do an activity with the horse. Some of it is mounted, so they're actually riding, and some of it's on the ground. And the idea of doing that is, first of all, to do something you've probably never done, right. Put you out of your comfort zone. We talk about being aware of how you're feeling.
They are encouraged to discuss their anxiety levels and rate them using the Likert scale.
It's also a very good team building activity because you feel secure because your newly found group members, who are all veterans, are around you to help to support you.
Week 1 is the most important and impactful part of the program. And Katie says the hardest part is actually getting the veterans out of the house and agreeing to attend.
First of all, everything's telling you stay home. I didn't sleep good last night. Right. I don't want to be in a group with other people. I don't know these people, they're civilians, all these things you're telling yourself not to come. So, but if I can get through and they actually get there and they meet the horses, then they form a bond with the horses. They may or may not with the group yet, but they have. In the very first meeting when we do the activity, choose or be chosen, they feel a connection with the horse.
Shamalian Arrieta was a second-class Master-at-Arms in the Navy and a Corporal E4 in the Marine Corps.
It was just a job that sometimes doesn't let you sleep at night because of some of the things that you've done, you've seen. But I got it done and I came back in one piece. That's all I'm grateful for.
Shemi had a hard time transitioning back into civilian life.
You just come back from that sort of mentality, you come here and you don't notice after a few deployments until people start telling you, hey, you're acting different or you're not over there anymore. You know, you need to calm down. I mean, you could be driving in the middle of the road and all of a sudden just pull over because trash or a dead animal, roadkill, or anything reminds you of IED. And one minute you're here and next you're over there again.
He tried many options, including exposure therapy, where they recreate the traumatic experiences with all 5 senses, none of which worked.
I came here with my brother-in-law, giving him a ride, and Katie asked me if I was staying. I told her, look, ma'am, no disrespect, but this isn't for me. I'm just here to watch. And she said, hey, that's fine. You know, she was very welcoming. She said, hey, you're more than welcome to stay, watch, do as much as you want. And I took her word and I gave it a try. When I came in and she let the horses go, that was something else. It was an experience to see Brooks back there run up to you, just stop right on your face. And everybody else was scared of him because he is a big horse compared to some of the other horses. He's a huge horse. But all I could think about is, hey, I want in there with him. I want to play. They're big animals, just like Marines.
Shemi explains how the behavioral therapist was very helpful, working with him to clarify the interaction between he and the horses.
They know how to match it up and explain it really good and break it down. From the hyper-awareness to just the fight or flight. I mean, so many things that they've helped us out with. We just trusted more the staff than anything, not really the animals. I mean, they kept us safe through the whole thing. They kept us reassured. They made sure that we knew they were in good hands. We never had an accident. It was always a good learning experience. I always left with a smile.
Shamalian recommends that veterans call McCormick, enroll in the program, and give it a chance.
Oh, I would highly recommend it for any veteran. Like I said myself, I didn't think I was gonna like this. I came with a closed mind saying I'm not gonna try it out. And just once you're here, it changes you, you know what I mean? It's something different and it's something special. These horses are special.
Francesca Langston was a corporal in the Marine Corps.
I was motor T, so I was a truck driver, 35, 31, and then when I went to Iraq, I was a machine gunner. I learned how to do that with the machine guns, so, and we did mortuary affairs over there when we were overseas.
She returned to the U.S. in 2005 and was medically retired in April of 2009 following a truck accident which left her with severe nerve damage in her face. She was heavily medicated after multiple surgeries as well as for post-traumatic stress disorder, anxiety, and insomnia.
I was really messed up, to be honest with you. And then I found the program. And since the program, I am totally off of all meds. I don't take anything. And my life has been a whole nother ballgame.
The Institute is a place for continued therapy, and shortly after she had completed the program, Francesca experienced a terrible tragedy.
Honestly, I didn't know how much the program truly helped me and how much being out here with the horses truly helped me until I lost my daughter last year. It's very hard, losing a child. And I was going back into a darker place. And my boyfriend told me, he's like, you need to call Katie.
She returned to McCormick to seek comfort from Katie and Tinkerbell.
And I think I groomed Tinkerbell for an hour, hour and a half. You know, something that can literally take you 10, 15 minutes to do. I mean, but I just talked to her, I talked to Katie, then we went for a ride, just me and Katie, and we talked.
It was that experience that made Francesca realize how greatly the program had helped change her life.
It really does, they make a difference, you know. That's when I really seen it. I think that's the hardest part, is actually stepping out and realizing that you have issues, you know, because it's hard to admit, especially listen, I was in the Marine Corps. You don't say nothing. You have no problems. So that's the hardest thing, is to be like, listen, I need some help.
Veterans are often apprehensive at first until they realize that everyone is there with a common goal.
We're all here to try and be the best that we can do and lessen the symptoms of PTSD. That is our overall goal, is to lessen the symptoms. It's still going to be there.
Sure.
That trauma is there, but how do I make the best of my life as it is?
And I do want to ask you about the children with different disabilities.
Yes.
How does equine therapy help them?
You can't be loud and, yelling and screaming on the horse. So, it has a very calming nature on an autistic child. It has a therapeutic nature on somebody with CP or Down syndrome or any of the other disabilities, because they have a 3-dimensional walk. When a horse walks, you go up and down, You go back and forth and rotational. A lot of people swear by it. We've had a client that she started riding with us at 18 months old, and they said she'd never walk, and she's now 11 and she walks very well.
Oh, wow.
She has support in her feet, but other than that, and her mom swears that it was the early intervention with the horse. And
that motion makes the brain feel as if it's walking.
yeah.
If people are interested, how do they get involved?
You can go to our website, which is McCormick, McCormick.us.
You can also visit the PATH International website for information on your closest local equine therapy center.
Well, we truly appreciate you allowing us to come out and spotlight what it is you do not only for disabled children, but also for wounded veterans.
Thank you for coming.
Appreciate it.
Absolutely.